I'm Matthew Taylor, the CEO of the NHS Confederation. The Confederation is the representative organisation for the commissioners and providers of NHS care in England, Wales and Northern Ireland. The Confederation first joined the IHF in 2018 and we're starting our fifth year of membership as the UK representative. The greatest strength of IHF membership for us over the last 5 years has been our ability to connect with leaders across the IHF community, to share our mutual experiences, insights and expertise. Over the past 2 years, it's been particularly valuable working with the IHF as we've been able to collaborate to provide expert speakers through workshops, webinars and conferences. Our collaboration with the IHF has helped us share international best practice with our members as they contend with the mutual challenges brought about by the COVID-19 pandemic. The NHS Confederation strongly shares the IHF's vision of a world of healthy communities served by well-managed hospitals and health services where all individuals reach their highest potential for healthy living. Healthcare in the UK is universal and funded through direct taxation. Health service policy is devolved to each of the 4 nations. The NHS Confederation represents 3 of these nations, England, Wales and Northern Ireland. In England, the provision of healthcare is very centralised, with NHS England and the Department for Health and Social Care playing significant roles in the detailed planning of healthcare provision. However, current legislation envisages a move to more devolved, joined-up, local policy making and management. For the past decade, the NHS in England has been on a journey towards greater integration between providers of NHS healthcare, social care, local government and the voluntary and community sector. We're now awaiting new legislation that will establish integrated care systems in law. The NHS entered the COVID-19 pandemic with 100,000 vacancies. The impact of the pandemic on the health and well-being professionals means that supporting staff and making the NHS an attractive place to work is more crucial than ever to the successful provision of quality services. As a result of the demand for care created by COVID-19, there are huge backdrops in care across elective surgery, mental health and community care. The current waiting list is bound to grow because so many fewer people came forward or were referred for treatment during the pandemic. They're yet to contact their general practitioner, so there's even more pressure on primary care. The NHS has as much to offer as it does to gain from our engagement with IHF colleagues. There are 3 areas in particular that stand out as being very exciting for us at the moment. First, environmental sustainability. Given the significant impact that climate change will have on the health of the population, the NHS is committed to playing its part in averting the worst effects of climate change. We're working towards a truly sustainable health system. Secondly, digital transformation. The NHS Confederation is fortunate to be a member of the various IHF forums related to digital healthcare. The NHS is increasingly using remote delivery, artificial intelligence and data analysis. And thirdly, population health management. A key focus of current NHS reform is how systems can proactively reach into their population to tackle the root causes of illness and disease and to reduce health inequalities.